Hi, ladies and gentlemen. It's Dr. Novoa. I'm going to give everyone a few minutes to log on. I know they're probably getting all ready for the football games and traveling for Thanksgiving, but I just wanted to do a little 15-minute presentation, so I'll wait a few minutes for everyone to sign on. Hi, everybody. I forgot my password for Facebook, so I can't log into the computer, and I have to reset it. You know the deal. If I reset it, I might not be able to go on the phone, so I'm going to probably have to post it off the computer after I reset it to YouTube. But I will set this video up for YouTube for those that are interested in watching. So I'm interested in everyone that's got friends and family members that have any type of fully conscious as well as general anesthesia procedures done. If you happen to be pregnant and you're going to have a baby, I wanted to try to explain why we prefer to do epidurals and spinals rather than general anesthesia, and also get into a little bit of talking about what's been going on with dentistry. For example, we've heard of some issues with some children that have passed away from just going to the dentist's office. And of course, we're always running into problems or stories that we hear from what's going on in Juarez related to going and doing cosmetic surgery in Juarez. So if everyone could just sign on and ask other friends to sign on. This is a public forum, so I would appreciate if you could get your friends to say, hey, Dr. Novoa is talking about general anesthesia, but he wanted to talk about Juarez and the plastic surgeons there and what's going on here. And so it's really important that you, if you could just get friends and family to sign on. I'll be glad to put it on YouTube later, but I wanted to do that. So anybody that's ever had cosmetic surgery, plastic surgery, ever had a baby, ever had dentistry done under anesthesia, and of course have ever had any surgeries done in Juarez, and more importantly now, because of what's going on with the breast implants and the issues of silicone implants and the idea of needing to remove them, needing to replace them. If you've had your implants in for more than 10 years, we don't go by the philosophy. I never went by the philosophy, but we don't go by we as surgeons don't go by the philosophy that just keep them in forever. They're not meant to be kept in forever. They're meant to be changed out about every 10 years. So, nevertheless, I think it's almost 1 o'clock, so let's give everybody a few more minutes. Some people have asked me, what's going on, Dr. Novoa? It looks like you're losing weight. I am losing weight. I know that every year around Thanksgiving, I do this weight loss program, and I've been doing I've been doing the HCG protocols for a number of years, and then I found out that, you know what? You don't need the HCG. You don't need the HCG. Well, so why bother going to the doctor's office and getting your subcutaneous HCG injections if you stick to the diet itself, which is a modification of the Atkins diet. And if you've ever seen my 600-pound life, you'll understand what we're talking about when the doctor there says that I want you on a diet and they're losing 30 pounds a month. You get an idea of what's going on there. But at one time I weighed 205 pounds, and then I was hovering around 190. I've been 190 up until 3 years ago. I was 190. And then I did the ACG again without the ACG drops, and I dropped down to around 180. And then I said, whoa, that's my son. He always knows when I'm going to do a video presentation, because that's what happens. If you can hear it in the background, that's what's going on. So anyway, every time that I stabilize at a certain weight, I say, well, in a few, I'll wait and see what's going on for a few months, and then we'll go ahead and see whether or not I can drop some more weight. So right now I'm below 175. I've not been below 175 in over 10 years, and my goal is 170 and maybe lower, but we'll see. Nevertheless, I think it's after 1 o'clock, so let's go ahead and start the presentation. There's a big confusion amongst the public and a seemingly misrepresentation of exactly what's going on related to cosmetic surgery. Most people don't know that there are more non-plastic surgery cosmetic surgeons than there are plastic surgeons. Now, plastic surgeons go through a residency program where they train how to do plastic and reconstructive surgery. Now, this is medically necessary surgery, and a portion of their training is in cosmetic surgery. So how to do breast augmentations, how to do tummy tucks, liposuction, and even plastic surgeons are getting into my specialty, which is cosmetic gynecology. Now, there are a lot more cosmetic surgeons now. What's the difference? Well, cosmetic surgeons start out in a different specialty, and then they get the training that they need to be able to do procedures in cosmetic surgery. And plastic surgeons start out as plastic and reconstructive surgeons, and a portion of their training is cosmetic surgery. So it's all based on the amount of training that you get and what your original specialty is. But we are all cosmetic surgeons. We just, what's the difference? That's the difference. So you can go to a maxillary facial surgeon, and that surgeon is a facial plastic surgeon. But that facial plastic surgeon doesn't know how to do breast augmentation, doesn't do tummy tucks, doesn't do vaginal rejuvenation surgeries, and the such. You can go to a ear, nose, and throat plastic surgeon, and that plastic surgeon, again, will be focused in on the face, or ophthalmology plastic surgeon who works on the eyes, again, plastic surgery, but only of the face. Then you can go to the dermatologist, and the dermatologist is trained how to do skin, and that dermatologist is trained how to do liposuction. So the significant number of liposuction is done by dermatologists, okay? You can go to a cosmetic gynecologist, such as myself, and we know how to do breast augmentation, liposuction, tummy tucks, and our focus is on vaginal rejuvenation or aesthetic vaginal surgery, and that's our specialty. So there's crossover amongst the cosmetic surgeons, and basically you want to go to a doctor who you feel comfortable has the sufficient training and knowledge and background to be able to do a particular procedure. So if you want to reconstruct the face, obviously you don't go to a cosmetic gynecologist. You're going to go to one of the facial surgeons, whether a maxillary facial, or I would feel more comfortable going to a maxillary facial surgeon than I would go to a plastic surgeon. And that's the difference there. It's a little bit confusing, but just to get an idea why I'm divvying up the different types of cosmetic surgeons and the specialties, because it's important to understand how we do our surgeries and what type of anesthesia we use. Very, very important to understand that. When you're doing reconstructive and plastic surgery, almost all of that surgery is going to be done under general anesthesia. When you do liposuction, for example, about half of those procedures are going to be done under general anesthesia, and half of those procedures are going to be done fully conscious. Now you're going to say, what? You're doing fully conscious liposuction? You're doing fully conscious breast augmentations? You're doing fully conscious vaginal surgery? Well, that's a distinction. If you can make the patients comfortable, then general anesthesia is not necessary. But depending on your comfort level and what you generally work with, you're going to use that. So if you're a plastic surgeon, you're more comfortable with doing procedures with general anesthesia than you are doing fully awake procedures, where the majority of cosmetic surgeons are trained and feel comfortable doing fully awake procedures, but they're not going to be doing aggressive reconstructive surgery, which would require general anesthesia. So What's the difference as far as comfort level for the doctors? It's safety. Absolutely, safety is the most important thing. Hi, everybody. Hi, everybody. Safety is the most important thing. And here is where, again, there's a crossover of what the information is and what's the actual facts are. All right. General anesthesia, unfortunately, is associated with the highest risks of potential complications and the highest risks of death. Point blank, no misunderstanding related to that. So if you decided you're going to have a procedure done under general anesthesia, whether or not it's cosmetic surgery, whether or not it's a hysterectomy, whether or not it's a knee replacement, all of those, if you choose to have a procedure done under general anesthesia, you have to understand that that has the highest complication rate and the highest risk of death. So under most circumstances, you really wouldn't want to do a elective cosmetic procedure under general anesthesia unless you had to do that. Let's take a moment to think about getting your teeth pulled, okay? If you can, local anesthetic would be the best way to go because it's the safest. Local anesthetic directly in to numb the spot is the safest. Then if you need IV sedation, increased risk of death. General anesthesia, increased risk of death. Therefore, when we're talking about children, for example, you probably have read, and if you Google right now, you probably read a lot of stories where poor little kids are going under anesthesia, even with an anesthesiologist right there taking care of the child. The poor children are, unfortunately, they're passing away from just getting a tooth removed or some type of a procedure like that. And why is that happening? It's because of the general anesthesia. It's not the procedure. It's because of the general anesthesia, because the children cannot metabolize that particular type of anesthetic, and there's complications related to that. So that's what we're talking about with general anesthesia. Perfect question for everybody that's had a baby, everybody that's gone to the hospital and seen a baby deliver. Whether or not it be by vaginal approach or whether or not you're talking about having it done by C-section. Have you ever asked the question, doctor, well, why don't you just put her under? Why can't she just go under general anesthesia and you just have the baby that way? She doesn't feel anything. She's not uncomfortable. You know, what's going on there? Why do I have to endure a spinal in my back? I'm scared. I'm going to get paralyzed. You're going to put a spinal in my back. You're going to put an epidural in my back. I'm not going to be able to walk again. I've heard about that all the time. People can't walk again. They've got problems with their back for the rest of their life. Why would you insist that I get an epidural or a spinal if I'm going to have a baby? Key point, and again, pass the message on. General anesthesia, when you're having a baby, has the most serious complications of death for both the mother and for the baby, as compared to the epidural or the spinal, as compared to not taking anything at all. This is key, very important. So if at one time you thought that, well, the reason that they give them the spinal or epidural, it's simply so the mom can stay awake, you know, and she can see the event, the blessed event, that's true. That's true, but if we found that it was associated with something, if it was safer to do it under general anesthesia, we would be having all of the babies under general anesthesia, and that's not the case. It is more dangerous to have a delivery under general anesthesia as compared to doing it under the epidural, the spinal. So even when you're having a C-section, even when you're having a repeat C-section, even if it's a potential complicated C-section, we're not going to put a patient under general anesthesia if we can do it by epidural or spinal, because it's absolutely safer to do it by epidural or spinal than to do it under general anesthesia. So that's what we're talking about with obstetrics. Now, there's going to be procedures that obviously you're going to have to do under general anesthesia. If you're going to do a laparoscopic procedure, if you've the Da Vinci robot, for example, you're going to need to do that under general anesthesia because you can't put in the trocars and manipulate the robot with the patient fully conscious, even IV sedated, because you have to control their breathing. If you're going to do a hysterectomy, even if you're going to do a vaginal hysterectomy, you can probably do that under epidural or spinal, but it's always going to be better to do that under general anesthesia. If you're going to have open heart surgery, of course, general anesthesia. But if you're going to have a kidney removed or replacement, of course, all of those are under general anesthesia, because obviously there's a threshold that you can go with either IV sedation or with fully conscious procedures that use tumescent anesthesia or local anesthetic. So this is keenly important. So, where are we going at? Come in.
Sorry. Hi, guys. I
Say
have to
it,
get something for the baby.
Right. Okay. So where were we? All right. So we're talking about medically necessary versus elective. And cosmetic surgery, by its very nature, is considered to be elective. It's not necessary to do a cosmetic procedure. Facial reconstruction is not considered cosmetic. It is a medically indicated procedure. So we're going back to cosmetic procedures. Here is why I mentioned why the differences of the specialties. There has been a misunderstanding or misrepresentation of the different types of anesthesia. Most of the time, plastic surgeons will insist on doing procedures under general anesthesia. They will not offer local anesthetic. They will not offer what's called tumescent anesthetic to do procedures. And the reason for that is a number of reasons. Either it's going to be comfort level, but at the same time, the use of tumescent anesthetic requires more time. It requires more time to be able to do a procedure that can be done safe and effectively under tumescent anesthesia to be done under general anesthesia. So it's a cost-effective thing. You can do more surgeries in a day with under general anesthesia than you can do it under tumescent anesthetic. So there's a cost factor related to that. And also, if you're going to do multiple surgeries on a patient, you're going to need to do that under general anesthesia. So if you want to have your face done, if you want to do a mommy makeover, you can't do that under tumescent anesthetic. It has to be done under general anesthesia. If you're going to do them all at the same time, you're going to do face, you're going to do breast, you're going to do breast lift, breast augmentation, liposuction, tummy tuck. You can't do those all under tumescent anesthetic. But what's keenly important again to understand, a mommy makeover is inherently more dangerous to do as a single procedure as compared to one procedure at a time. That's keenly important here. So when you want to go in for a mommy makeover, you have to understand that by doing multiple procedures, you're putting yourself at risk, a significantly higher risk of having a complication or even dying from the procedure than if you would to do one procedure at a time. Yes, it takes more time, but it's safer. And that's the thing when surgeons say that, well, this is safe. In terms of what? Because you have to have a comparison. So this is what the comparisons are. What I wanted to give you is throw some numbers out at you and have an understanding of what the risks are. Let's talk about what procedure of the cosmetic procedures, which happens to be the most popular. Also, it has the highest risk of death if you do the procedure under general anesthesia. Anybody venture a guess? I know you can't answer me. Would you say number one, it's going to be breast augmentation? Would you think number two, it's going to be liposuction? Would you think number three, it's going to be tummy tuck? Or do you think number four, it's going to be vaginal surgery? Okay? Which one of the four? The one with the highest risk of potential death under general anesthesia is going to be the tummy tuck. All right? Now, if you decided you're going to do liposuction under general anesthesia, the risk of death from liposuction is 1 in 5,000. Now that doesn't sound like it's a lot. 1 in 5,000 doesn't sound like that's a lot, but you don't want to be the 1 in the 5,000 that has that happen. And all of us have heard those stories where someone passes away after having liposuction, especially, for example, in Juarez, Mexico, that we heard the story of, unfortunately, the El Pasoan who went to Juarez and ended up coming back to the United States, and unfortunately she passed away after having had cosmetic surgery done. Now, in comparison, if you have liposuction under general anesthesia, the risk of dying is 1 in 5,000. If you have a tummy tuck where you remove not only the fat or the skin in the abdominal area, your risk of death is between 1 in 1,000 and 1 in 2,000. So it's double the chance that you'll die from a tummy tuck under general anesthesia than if you do just liposuction of any part of the body under general anesthesia. Under general anesthesia. Now, what's the risk of death if you do these procedures as a fully conscious tumescent procedure? The risk of death for liposuction, if you're going to do it under general anesthesia, the chance is 1 in 5,000. If you're going to do it under fully conscious procedure awake, the risk is 1 in a million. 1 in a million. 1 in 5,000 under general anesthesia, 1 in a million under fully conscious tumescent anesthetic. That's 2,000 times greater chance of safety if you do these procedures fully conscious. Then why aren't we doing them all? Because it's not cost effective to do these procedures as fully conscious, true tumescent anesthesia. It's not cost effective to do that. Okay, you want to do more procedures in a day. You want to get more money for the procedures that you do. You're going to do them under general anesthesia. Easier, faster, more cases. Do we tell patients that? No, we don't tell patients that. Now, in comparison, there is what's called true tumescent anesthesia awake. Okay? These procedures are exceptionally safe. Exceptionally safe. Reported cases when you screened your patient properly, when you've used the actual formula as indicated, and when you stick within the parameters of the protocols, there hasn't been a reported death in over 30 years if you stick to those protocols. Not a single reported death in over 1 million cases. There hasn't been a single reported case of a tummy tuck if you use true tumescent anesthesia awake in that either, as compared to 1 in 1,000 if you're doing tummy tucks under general anesthesia. These are key, exceptionally important. So let's do a comparison of other procedures, okay? Just so that I throw some numbers out at you. If you were required to have a hysterectomy done, if you had to do a more invasive procedure, such as a hysterectomy, and it's going to be an abdominal hysterectomy, and you need to get in there and you need to remove the uterus, you have to go through the skin, got to through the muscles, you got to get into the pelvis, and you've got to remove the uterus. You would assume that by doing that it would be more dangerous, more potential risk of death as compared to doing a tummy tuck. And in reality, no. The calculated risk of the same type of patient under the same circumstances having a hysterectomy as compared to one that's going to only have a tummy tuck, the probability that the person with the hysterectomy would have a complication leading to death is half the risk as compared to the tummy tuck under general anesthesia. So not only is the procedure itself inherently more risky, but the use of general anesthesia is inherently more risky. These are facts. You can look this up. I can post the references because there's going to be doctors who are going to say, hey, Novoa, stop raining on our parade. Stop telling patients what's going on because you're costing us time, money. And I can tell you that I get this all the time. You know me. I've talked about teen pregnancies. I've talked about high C-section rates. I've talked about Da Vinci and how that was a money thing for OBGYNs. I've talked to you about eSure, how we got that off the market. I've talked to you about vaginal meshes, abdominal meshes. I've talked to you about watching the Netflix documentary on the FDA and on doctors. So I'm not going to sugarcoat anything. You want to know the truth, you want to know the facts, even though they include me, I'm going to tell you what's going on. That's what I have promised that I would do for you, even if it includes myself. And let me tell you, I get a lot of slack. I get a lot of false information stated about me. I get a lot. And the only thing that I can ask you to do is sit down, look it up yourself. If you got any questions, sit down, come in, we'll talk about it, or we'll have some time for some video questions on Facebook. And please, I'm going to post this on YouTube, so go ahead and share it with everyone. So in comparison to that, if you have a 1 in 1,000 chance of dying from a tummy tuck under general anesthesia, and you have a 1 in 2,000 chance of dying from a hysterectomy under anesthesia, what is the chance of dying from a C-section under epidural and spinal? And we're looking at 1 in 17,000. So if you have it done under IV sedation, spinal, epidural, your chances now are 3 times better as compared to if you're going to do it under general anesthesia. So general anesthesia is the culprit in almost everything that we're talking about. And why don't we do more fully conscious procedures? Because you're getting misinformation on purpose, because it's so much easier to do procedures under general anesthesia. Now, there's some really great plastic surgeons here in El Paso who are getting the message out and starting to do these procedures fully conscious. And I commend them because they are seeing that safety comes first. Patients before profits come first. And that's what's keyly important in all of this. This is the message that we're trying to get out. This is why I've been doing fully conscious procedures for 10 years now. And let me tell you, there have been some really bad days as far as getting the pushback from both OBGYNs and plastic surgeons on this subject. But the message has to get out. And that's why I'm doing this video. So, what I wanted to really talk about now is the confusion or the use of the same type of words to seemingly make it look like we're all doing the same type of procedure. We're not. So now that I've stated my opinion on general anesthesia, now again, if you know the risks and you're willing to take them, no problem. More power to you. You've made a decision. Now let's talk about awake procedures. There is a difference between saying that you're doing something awake and doing an awake procedure. So if you're saying that I'm doing liposuction and you're awake, there's a difference between that and saying that I'm doing awake liposuction. Because the term, although it hasn't been copyrighted or trademarked, the word awake means something. It means something to the cosmetic surgeons who are using the technique. What it really means is true tumescent anesthesia. True meaning that it is a set formula that was created by Jeffrey Klein, who is a dermatologist. It was created more than 30 years ago. It has an exceptionally safe rate of use, with over 1 million cases being used. It was such a good formula that the plastic surgeons started using that formula. But they couldn't use it to the extent that it was created. True tumescent anesthesia lidocaine is an exceptionally safe procedure type of formula to use. But it cannot be used in its true form if you're using IV sedation or general anesthesia at the same time. You have to modify it because you can't use multiple types of medications at the same time to do the same type of procedure. So, since tumescent anesthesia is not a trademark term, both the plastic surgeons and the cosmetic surgeons were using the same term, but not with the same meaning, not with the same formula. So you're going to get plastic surgeons to say that they do tumescent liposuction, that they do tumescent procedures, and it doesn't mean the same thing because they're still using IV sedation and they're still using general anesthesia. And when you modify the formula, the risks of complications and the risk of death go up. And that's the difference between that and what cosmetic surgeons are doing fully conscious. So here we're trying to separate this terminology. If you read on the websites, oh, I use tumescent anesthesia, you're not using true tumescent anesthesia as it was created by Jeffrey Klein. The risks are higher, especially if you're using IV sedation or you're using general anesthesia at the same time. So please do not get confused between what the plastic surgeons use as tumescent anesthetic or what Jeffrey Klein calls semi-tumescent anesthesia and what the cosmetic surgeons use as true tumescent anesthesia, or another word for it is awake. This is keenly important. So If you're going to have a procedure done and they start an IV on you and you don't remember anything that happened after that, you're not getting true tumescent anesthesia. For the over 4,000 patients that I've done surgery on, all of you know that you were fully awake during the procedure. You're fully aware of what was going on. And that is true tumescent anesthesia, whether or not it was a breast augmentation, a liposuction, a tummy tuck, vaginal surgery. I've done over 4,000 of the procedures. And because of its incredibly safe record, it can be done in an office-based surgical center, and there's differences. If you're going to do true tumescent anesthetic procedures, you can do them in an office-based surgical center. If you're going to do semi-tumescent or tumescent procedures like the plastic surgeons do, you're going to need to do them in an ambulatory center, or you're going to need to do them in a hospital. And here again is the key thing related to, hi everybody, key thing related to doing them awake versus doing awake procedure versus doing a procedure awake. Doing tumescent, how the plastic surgeons do it, versus tumescent, how the cosmetic surgeons do it. So I just wanted to get that word out and get you to understand the difference between the significantly higher risks of doing a procedure under general anesthesia and doing a procedure fully conscious, awake. And I've been doing them for 10 years, and the data from the American Society of Dermatological Surgeons, the American Society of Plastic Surgeons, the American Academy of Cosmetic Surgery, and the International Society of Cosmetogynecologists. We all pretty much know what we're talking about, the agreements are, and what the differences we have seen and have been documented, especially by the Centers for Disease Control and the Departments of Health and Human Services, of why there are risks related to general anesthesia. What blew my mind, and I have to tell you this off of as just a regular person and not as a doctor, what blew my mind was looking at the data related to tummy tucks. Because the plastic surgeons have a very, very refined protocol and for the complications of a tummy tuck. Some of them actually require that you use some type of agent that won't clot your blood for up to 2 weeks after you have a tummy tuck. So you're injecting yourself with something like Levinox or heparin for up to 2 weeks because of the risks related to the general anesthetic and the procedure. You're required to go home and walk a lot and inject yourself with Levinox or some heparin to prevent you from throwing a blood clot, because the most common complication related to general anesthesia is going to be throwing a blood clot from your lower extremity into your lung and passing away from what's called a pulmonary embolus. It sounds pretty bad, and it is pretty bad. What you don't know is how often here, even in El Paso, patients have died from the complications of general anesthesia as compared to true tumescent anesthetic, and how many more patients have wound up in the ICU of every hospital here. And unfortunately, they're all associated with complications from surgeries done by plastic surgeons, because we as cosmetic surgeons don't do procedures that require general anesthesia, and no ICU admissions, and no deaths from the anesthesia itself in El Paso. So I believe that almost every plastic surgeon has unfortunately had a complication from general anesthesia that's led to either an ICU admission or the death of the patient. It doesn't happen very often, but it's not something that's publicized. You can't go on the coroner's report and look that information up. It's not there. So it's by word of mouth and the nurses talking in the hospital and such. But it's happening. So that's what's so important about all of this. So the key to all of this is just to remember, talk to your doctor, ask him to be straight. Unfortunately, you can't go to a plastic surgeon and ask the plastic surgeon to talk to you about true tumescent anesthetic, because they don't use those. They don't do that procedure. And therefore, if you're interested in that, you're going to need to talk to a cosmetic surgeon about that and try to weigh the balance of what option you really want to take. And that's great. And there are plastic surgeons in Juarez, for example, who I've shown the technique to that actually use true tumescent anesthetic. I don't know of a single plastic surgeon here in El Paso that uses true tumescent anesthesia. They all use the semi-tumescent or their technique, which is not the same as awake anesthesia. Now, the next point is the vast majority of women and men, that have had breast augmentation done and it's gone on and they've had their implants in for more than 10 years, you're going to have to consider getting those implants replaced, especially if you have silicone implants in place. So if you have those implants coming on 10 years, do not go by the recommendation that they can stay in forever. They can't any longer. The studies have suggested that either they're going to rupture, or if you have silicone, especially if you have gummy bear, because gummy bear was the big fad, gummy bear implants leak just almost as often as the traditional implants. And if they leak, one of the ways that you're going to have to look for that leak is go through an MRI or a highly focused ultrasound that can be done. So you can't go by the idea it's been in there for 10 years any longer, that I can keep them in for 20 years, 30 years. No, you're going to need to consider, especially if you have silicone implants, to have those removed. So how are you going to have them removed? How are you going to have them replaced? Are you going to go under general anesthesia with a plastic surgeon? Or are you going to find a cosmetic surgeon that is willing to do it as a true tumescent anesthetic procedure? This is what you're going to have to decide. Unfortunately, the messages that were given to the majority of patients by both cosmetic and plastic surgeons is that breast implants could stay in forever, especially if they were gummy bear. That's not the case. We have changed our recommendations now, and all of those implants need to be replaced. And if you have, you're going to have to find a surgeon that it has to be done under some type of anesthesia. So now you're going to have to decide if you're going to do it under fully conscious or under general anesthesia. Now, let me be a little clear, because I just saw one message or one question. What about if they're saline? Okay, one very nice thing about saline implants is that if a saline implant ruptures, you're going to wake up one day and one breast is bigger than the other. And you're going to say, oh, my implant ruptured. Or you're going to notice over time that one breast is bigger than the other because that implant is leaking. And the great thing about saline implants is that it's salt water. The same thing you get in an IV. The same thing you would get if you went to the hospital and got IV hydration, or if they needed to do a small procedure. The same thing that you get when you're having a baby. That's going to be placed. So it's saline, and it's going to be absorbed by the body. So saline implants, and generally the worst case scenario is that they will rupture, and you'll have one breast bigger than the other, and it's, whoops, time to replace my implant. Now, for silicone, it's a different story. For silicone implants, the Allergan Corporation and Mentor Corporation, for example, have said in their studies that have shown in their studies that these implants will rupture over a period of time, and it's not unusual to have a rupture of a silicone implant of up to 10% over a 10-year period of time, even in the gummy bear series. So, in the small print related to Mentor and Allergan, it states that there should be an evaluation of these implants by MRI. A lot of the plastic surgeons and cosmetic surgeons are saying, well, maybe just an ultrasound is enough. A high compression ultrasound might be enough. That's not accepted yet by the FDA, but it's a good start, especially if you can't afford the cost of an MRI. Now, I believe that there's some great plastic surgeons here in El Paso. I believe that the ones that are promoting tumescent procedures are really up there and doing the very best that they can. And I just want to make sure that you understand that this is the case. I believe one of the best plastic surgeons here in El Paso is going to be Dr. Marcos Gonzalez. I don't know him personally, but I have seen a lot of his work. I have seen a lot of his patients as OBGYN patients. So I honestly believe, and I went on his website and I read that he does not true tumescent anesthesia, but he does do tumescent anesthesia, and he promotes it, and we all agree. Now, I'm not promoting Dr. Gonzalez, but I know that Dr. Marco Gonzalez, from seeing his patients, from talking to his patients, that he is a true patient advocate. And I really think that if you want an opinion from a plastic surgeon that's going to be that's going to give you an honest opinion on what's going on with plastic surgery, is going to be Dr. Marco Gonzalez. So please take that name down, Dr. Marco Gonzalez. I've never met him, but I know of him, and I know of his, because I see his patients, as OBGYN patients. So if you want that, go talk to Dr. Marco Gonzalez and his team. They're over on the west side. Now, I'm more than happy to tell you and talk to you about true tumescent anesthesia. But there is a difference, obviously, and when you use one versus the other, and there are also safety issues. So that was my point. I wanted to stress that there's a difference between tumescent anesthesia used by plastics, and there's a difference between true tumescent anesthesia used by cosmetic surgeons. So keep that in mind, especially for those patients that are going to be having their implants replaced because of the anniversary dates or for any other reason. That it's very important that you understand that difference. Now, as far as breast reduction, breast lifts, and reconstructive breast surgery, again, I've seen Dr. Marco Gonzalez's work. It's excellent work. Here's a limitation where you're going to see with true tumescent anesthesia. True tumescent anesthesia cannot be used, a fully conscious procedure to use for breast reconstruction, for breast reduction, and for breast lifts. That is where you're going to need to use tumescent anesthetic technique by plastics, IV sedation, and general anesthesia. And again, I've seen Dr. Gonzalez's work. It's excellent. So if you have any of those issues, and really, it is in some cases like night and day, because I've seen the work of all of the plastic surgeons, and I've been able to compare, especially in what they're charging and what their overall outcome is. And again, I'd have to say that Dr. Marco Gonzalez has got some of the best work in El Paso as far as that's concerned. So that is one limitation related to true tumescent anesthesia, that you can't really do that if you're going to do removal of capsules from capsular contraction, if you're doing breast reductions, if you're doing breast reconstruction, or if you're doing breast lifts. And so that's key there too, to understand that difference. And finally, as I said before, if you're going to do multiple surgeries, you can't use true tumescent anesthesia for multiple surgeries. We do them one at a time. So if we're going to do breast augmentation, we're going to do breast augmentation on one day. We're going to do liposuction, we're going to do liposuction on one day. If we're going to do tummy tuck, we're going to do tummy tuck on one day, unless it's a liposuction and tummy tuck in the same area. And although I can appreciate my the plastic surgeon colleagues who are doing vaginal cosmetic surgery, I would have to say that I believe that I have more experience related to vaginal cosmetic surgery as compared to my plastic surgeon colleagues. But nevertheless, I'm sure that you can arise your opinion on that subject as a separate subject. So I think that I've said pretty much what I wanted to say, that there is a difference between tumescent anesthetics used by plastic surgeons as compared to true tumescent anesthesia used by cosmetic surgeons. The risk factors go up from true tumescent anesthesia to IV sedation to general anesthesia, and you have to be aware of the potential risk for that, especially since these are considered to be elective procedures. They're not necessary. They're not medically necessary. They are elective. But I think it's important to understand the distinction between one and the other. As I've always said, these videos are designed not to promote myself, but to promote the facts. I always encourage you to look up the information that I've given you and find out and say, hey, well, Dr. Novoa, you said this, but I read this. What's the deal? And I'll be glad to answer that. And if you're really Google searching, as far as plastics are concerned, Dr. Gonzalez would be a great choice. Again, I keep stressing, I've never met him, but I've seen his work. And so that's what I think that you should do. And if you have any questions related to cosmetic surgery, especially vaginal surgery, I'd be more than happy to answer your questions. So thank you so much for watching the video. I really appreciate your time. If you want to shoot me a message for the next topic, we'd be glad to talk about that. And be aware that I will post this to YouTube for everyone to take a look at. Thank you again so much for watching. Happy Thanksgiving.